Hi, everyone. Welcome. Thank you for joining us. We just have folks starting to jump on here. Happy Friday to everyone joining. Just going to give everyone another minute or so just to hop on here, and then we'll kick off. Hi, everyone who's just jumping on here. Thank you for joining. Great. Okay. I see a few more folks jumping in here, but want to be mindful of time. So we're going to get started. So thank you everyone for taking an hour of your time on this Friday here to join us with our friends from Spruce Health, excuse me. We're so excited to have them here to talk about the do's and don'ts of client communication. So we have two wonderful guests here. We have Carrie from their marketing team and Jess, their head of sales. Jess will be presenting on this topic. She'll be going deep into everything. And throughout, Carrie will also be helping to coordinate with the Q&A. So I'm sure they'll speak to this, but please make sure you are using our Q&A functionality at the bottom of your Zoom webinar here. It's a great opportunity to ask questions, see kind of what Jess can walk you through during the next hour. So thank you again, Spruce Health team, for joining us. I'm going to pass it over to Jess now.
Okay. Well, nice to meet everyone, and thanks for joining on your Friday morning for your West Coast, as I'm in the West Coast here, San Francisco, and lunchtime for everyone else. Background for me, I've worked at Spruce for 8 years, so I've been in patient communication for 8 years, talking to independent health providers for 8 years about HIPAA compliance, better ways to communicate. And here at Spruce, we're a healthcare communication software dedicated to medical professionals. About over 50% of our professionals are in the mental health field. And we do everything around communication. So phone, texting, telemedicine, fax, team collaboration, you name it. And then we also make it easier for you to collaborate if you're part of a team around those communication channels. So, feel free if you have extra questions about Spruce, happy to answer those at the end. But today, as we talked about, it's about the do's and don'ts of client communications. And, it sounds really strict, but this is actually a spectrum of what you should be doing. And most importantly, I really, really want to hear questions from you during the different topics that I'm going to talk about, because this is here to help you and get resources. And HIPAA compliance is often very misunderstood. They're not out to prevent you from communicating. They're here to help you communicate safely for your patients, to protect them. So that's what my goal of this meeting is, to know that, we really can communicate with our patients openly. You just have to get their preference. So lightweight agenda here, not really actually that lightweight, but what is a BAA and do you need one? It comes up a lot. HIPAA compliance, and is it important in therapy? Is texting your patients okay? I would say that's my number one question I get, and the number one thing I have to clarify. Phone lines, faxes, and HIPAA, what's acceptable? And your phone lines can put you in a risky position, and email, and some other tips that we're going to do. And then I'll take general questions also at the end, but please feel free to look at the bottom. There's a little Q&A. Click on that, ask a question, and myself, I'll answer them, or Carrie will also be there to answer them asynchronously if it's something about Spruce or something. So I'm sure you guys have heard the term BAA, or Business Associate Agreement. So this is a very, very popular term you hear in healthcare practices. And it is a requirement, but it's pretty simple. If you're a covered entity, you must have a written agreement with anyone that's a business associate. So basically, are you a covered entity? If you are a healthcare professional, you are. If you are working with a client or a patient, you're a covered entity. If you're a business like Spruce, we are a covered entity. So we have to sign a BAA with you, because guess what? We're holding your patient data. So anybody that has your patient data in any form, you need to have a BAA. And what that BAA agreement's saying is, what are you going to do to make sure you don't lose, or you are holding my information securely? Every BAA is an agreement that's custom. So each one could say different things. So it actually is really important that you don't just get a BAA. You need to read the BAA and see what's covered in the BAA. And I know that's hard because it's very nuanced and there's all these, legal terms. And trust me, I've been looking at these for years and I still get confused. But you really just want to make sure you know how they're storing your data and how they're protecting it. Do they have login protections? Do they, what are they doing for that? So just make sure, you read it. There's certain companies that have very, very strict BAs. And then there's some that are going to tell you, you know what, turn off voicemail transcription. If you're going to use our BA says you have to turn off voicemail transcription. At Spruce, that's not true. We have HIPAA compliant voicemail transcription. And the reason some companies do and don't have this is because in order to make voicemail HIPAA compliant, you have to be able to store the data in a secure way. And that's not often easy or cheap. So you have to do it in a way that's going to comply by the rules. And not all companies want to do that because maybe only 10%, 5% of their customers are in healthcare. With Spruce, again, everyone's in healthcare. So we've just made everything pretty much secure. So any questions about BAAs, feel free. You could always get a copy. Also, another question, this is just kind of my own 2 cents on this, because I get this question. We probably get this question every day at Spruce. Do I need to get a signed copy of, do I need to sign the BAA? No, like you can do a click through, which means like you check a box and you agree to the terms of service, which often includes a BAA. So you don't need a physical copy that has your signature on it. You can always get a physical copy of the BAA and print it if you need that, or download it into one of your inboxes that you need. So quick tip there. All right, moving along. So is HIPAA compliance important? Well, yeah, that's why we're all here and why you guys are listening, right? So HIPAA and compliance, a lot of people get very scared or bored. And, we all have to take our HIPAA compliance test each year. And so sometimes, we just check off that box. So here's a really easy checklist. All right. So how to standardize your coding in electronic transmission. The easiest way to do this is to use an electronic health record. This way, it's already built to secure all your coding, and it's just going to make it the easiest just to check that box. I'm securing my coding in electronic transmissions by using electronic health record. EHR, EMR, they're called different things at different practices. We've seen a trend since I started at Spruce 8 years ago. I would say maybe half or less, like 30% of my therapy practices were using EHRs, now pretty much 100%. So you guys are mostly all checking this off, but it is an easy way. All right. And then you want to make sure, get unique identifiers for you and your organization. You want to make sure you have NPIs for all of your practitioners. So that is something you can go on, Google it. You can get your NPI if you don't already have it. So make sure you get that. Protect your patient's privacy. So this is really important because obviously you want to protect all your patient stuff, but make sure that you're storing all data carefully. You want to make sure that, everything is not open out in the open, or, that another client can see. You want to just make sure that your privacy, the privacy of your patients is protected. 4, secure your electronic medical information. So this can be as simple as making sure everything's password protected, making sure your computer is, it has a timeout after 5 minutes or 10 minutes and requires a password, because what if you, leave the room, someone can see your computer. So just, and we have deep details on each of these points that we can share with you as well, that you can go through. But basically you want to make sure that you have administrative control. So who in your practice gets access to different things. So in Spruce's application, you have an admin and you have a regular teammate, and they have different access points. So you should be having that for, if you use Google Drive to store stuff, if you have folders or files, or, within the EHR. And then physical, you want to make sure that you don't have files out. So physically make sure things are protected. And then technical is going to be using softwares that are going to be protecting your information and have BAAs with them. All right. Understand the penalties for violations. So you don't really need to understand this entirely, because you know that there's a penalty for violating these things. But then if you were to get investigated, they will talk to you about it. And so you don't need to do anything proactively there. All right. And then learn how to handle information breaches. So you just want to make sure that, this doesn't happen, that you have all your protected information. If another company that you work with has it, they will give you information on how to handle the breach. We've all gotten those emails, right? I mean, it's all the time. We're like, oh, your password's been compromised. And then they tell you to reset your password. That's kind of what to do to be informative, is you read those emails and do what the company says. All right, no questions. Also, let me just check and see. All right, how many people we have? All right. Okay, so this is the one that I get the most, texting. And texting this term can be used in a couple different ways. You have SMS texting. So SMS texting is when you text from to the patient's cell phone. So it goes right to their cell phone. If you use an iPhone, it's iPhone. If you go to your Android, it's on the texting area. So that's texting, that's SMS. It's going over our cell phone carrier or data. So it's in an insecure kind of sending pathway. You don't know what device they're using. You don't know what internet it's being transferred by. So we don't know. So first, what you want to do with texting, SMS texting, is find out if the patient wants to use it or if they're okay with using it. So this is called finding out your patient's preference and documenting their consent that they're okay with texting. We all go to doctors, and so many doctors' offices and therapists now have a little checkbox. Are you okay with texting? And another tip that I always say here that's been around a lot longer is email. We've been emailing on non-secure email for years prior to doing texting. And so with email, we usually check that box. That's been in your terms that you sign with your practitioners all the time. So if you already have that, you can just add texting to that. That's a great way of doing it. And you also can do this verbally. So people often ask, like, do I have to have it actually written out? You don't technically, but it is a spectrum. And if it's easier if it's written out. All right, so you want to find out their preference. So guess what? All my patients say, yeah, I love texting. I mean, I do. And so then the second part of that, it's not just getting permissions. The second part is making sure that you're storing those texts in a proper manner. So if they said they're okay with text, then you're just using your personal cell phone, not the best situation. So you want to make sure that the mobile devices or the applications you're using texting to the patients with or clients is a HIPAA compliant and secure texting device, that it's not gonna have other people be able to see the text messages or have the context compromised. So that's another really important thing. The last thing here is it is better to use an encrypted texting solution instead of SMS. It just is better to have the highest level of security. Does it mean that you can't text? No, not at all. Again, we want to communicate how the patient wants to communicate. So do the SMS texting. But if you can, let's try and keep where the texts are encrypted and secure, or use an encrypted texting solution. So an encrypted texting solution would be more just like a secure messaging solution. What we see in the commonplace is an EHR portal. It's not really email. It's not really text. It's just secure messaging. And what makes it secure, kind of an easy way to kind of think, is it secure or not? Are they both is there a login for the patient? And then you have a login to view it. So it's secure from end to end. I think of it in my head like a steel tube that nobody can get into. Versus our text to our friends, like go over insecure paths or on like our cell phones that who knows what's going on with those. Yeah, so that's about texting. I saw a question about email. We're going to get to it. Oh, wait, there's 2 questions. Hold on. Okay, great. So I'm going to get to both of these questions in a minute. I realize the slides we have more detailed. So, and if I don't, then I'll answer them. All right. Do I need to get written consent? See, I already got ahead of this one. So do you need to get written consent? No, there's no requirement that says you have to confirm in writing. Okay. Is it more helpful? Is it easier for you? Then yes, do it. But it is not a requirement. It does not say you have to get it in writing. But it helps and it's easier. HIPAA is a spectrum. It's not binary. It's not like I get a BAA and I'm good to go. It is constantly, you have to be thinking about this. And we have a template that we share with people. So this is, you'll see here, that the template here you can read, and we are happy to share it if you'd like. And this is just an easy one. You can put in your terms of agreement when they sign up for your practice. We also have a feature where you can create a saved message, and then you just type dot or period, and then you could do BA or consent, and it will pop this into the text message with the patient. And then also with Spruce, we have a way that they can download the Spruce app. If they don't want to consent to SMS texting, they can consent to downloading the app. But with Spruce, they don't need to download the app. It's just they can do the texting. So, all right, I'm going to answer this next question that came in. Thank you. Is Business Google with BAA HIPAA compliant for text using Google Voice? All right, so Google Voice is free. Then you have Google Voice through Google Workspace, and that's the paid version that offers the BAA. So again, Google Voice, free, no BAA. Google Workspace, BAA. And as I said a few seconds ago, just getting a BAA is not good enough. Unfortunately, it's not that easy. So with Google, and this is the last time I checked, so please make sure to read your own terms and your own BAA. But last time I checked, Google BAA has a carve out, meaning we store everything in a secure way, but a carve out is like a but. Their contacts are not secure. I don't know why Google has done this, but their contacts are not secure. So you're not supposed to store any contacts in Google. My guess is Google is connected to so many things that then it could relate those contacts to other Google products that you may use that are not secure. So with the Google Workspace BAA, what was the question? Hold on.
Yes, I
yeah,
already.
yeah, it's okay. Yeah, I can clear them because I can see them. All right. This question is Google Voice, the BAA one, HIPAA compliant for texting using Google Voice. So once again, any way can be HIPAA compliant if you get the permission from the patient and you're storing the text securely. So technically, with Google Voice or Google Workspace, Google Voice, it can be HIPAA compliant if you get permissions from the patient and you do not put their contact information in. Personally, that seems like a liability because if I don't have their contact information, who is it? I don't want them. I don't know who texted me. Who am I texting? So it's just not good enough in my mind. And I have some other, it doesn't have as many good features as something like Spruce, but it can be. It's just a little bit more work for you. And there's a possibility you might text the wrong person if you can't put in the contact. Okay. And then someone asked about if we're using Spruce on the personal phone with password protection on the app and using SMS within Spruce, does that count as HIPAA compliant texting device? Yes. Spruce has been made to be used on your personal cell phone. This is my personal cell phone. It has been made to be used on your personal cell phone and keep it HIPAA compliant because everything's enclosed in that Spruce app on your cell phone in a HIPAA compliant way. Everything's securely locked. We have administrative controls. So you have to have a login. We have 2FA where it's going to send you a code. Each teammate has their own login as well. So it's all right there for you. And you can restrict who has access. So yes, if you're using your personal phone and Spruce or another HIPAA compliant app, then it is a HIPAA compliant texting device. You're not using your personal cell phone number to text, you're using your Spruce number within the Spruce app. Okay. Okay, so another great question. And this is the slide that we're on, this is relevant. Is the same guidance for marketing, texting a client, just reaching out based on referral submission? Okay, so I have two examples here that I think are commonplace. And if not, feel free to bring up another example. But one, a client reaches out to you, a client calls you, and you want to text them. They're not your client yet. You haven't gotten their preferred permission, etc. So with HIPAA compliance, with texting, the important thing is not texting PHI. So you don't want to do any identifiers. I think I'm going to go into this shortly, but you want to make sure. So if you're just texting someone, thanks for, submitting your request to Jessica's therapy practice, that is actually okay to send to the patient because you're not revealing specifically what condition they have or identifying information. So I didn't say the last name. I didn't say date of birth. I didn't say Jessica's practice that specializes in talking too much on webinars and, my condition. So it's nuanced. I get it. And I think a lot of people know this, that like if you're just talking about appointments, that's pretty much okay. But if your practice name does specify exactly what you have, so like one would be like maybe Jessica's practice for those with eating disorders. That's a little too specific. So if you text them and it says that name, that's a little too specific. That's PHI. So for marketing, you want to make sure you use a generic practice name, counseling, therapy, all of that's fine. And you don't want to be sending any PHI. So for example, with Spruce, we have a feature where if you get a missed call, it can auto text you back. So you're auto texting them. Thanks for reaching Jessica's counseling. Sorry we missed your call. You can check out more information on my website or respond to us here. That's perfectly fine. Okay. Yeah, referrals. Okay, I got that answered live. So if a client, okay. Next question. If a client just texts directly to the Spruce phone number that's considered to be HIPAA compliant, they don't need to download the Spruce app. So with Spruce, we offer two types of texting. SMS, where they don't download an app and they're just texting your number from their cell phone number. That can be HIPAA compliant. And another thing that's pretty much the rule now is if a patient initiates a text with their own PHI, you can't really stop them. So it's hard to argue that, you could respond to them and be like, hey, this isn't secure. Are you okay with this? Or you can alternatively use the EHR portal or download the Spruce app if you'd prefer secure communication. Most people are going to be like, no, I don't care. I just texted it to you. So know that if they text the Spruce number, it can be HIPAA compliant. They don't need the app. If they want secure communication, then they're going to want to download the app. All right. Okay. Let's keep moving because I know there's a lot of good stuff here. Okay. Phone lines, faxes, and HIPAA. So this one always cracks me up because I think when HIPAA was first, HSS was creating HIPAA and creating these rules, fax and phone were so prevalent that they're like, how are we we can't tell them to not use these. And so essentially they made them a carve out. And so is it HIPAA compliant every time I call or fax? No, that's because typical phone calls and faxes are not considered ePHI. That's just what they made in the rules. So when does a phone call or fax become ePHI? So this, I think, is a really important fact because it's similar to texting. You got to think about how is that voicemail or call log stored? Where is it stored? Is it stored on do you have your missed call logs and it shows your clients' names and they're in your missed call logs and anyone that picked up your phone could just call them? That's a no-no. So that's where phone calls can violate HIPAA compliance rules. So, and then I don't want to miss the good stuff on here. Oh yeah, and so with ePHI, it only applies to the transmission. So, but it doesn't comment on the storage. So again, with faxes, voicemails, call logs, it's important that you are storing these all in a HIPAA compliant and secure manner. Your cell phone, if you're not using Spruce or another HIPAA compliant app, it's not secure. So where that voicemail is stored, how it's being transcribed, like with AT&T or Apple, whoever's doing it, it's not in a HIPAA compliant way. So it means someone can steal it. So, all right, and this one's more complicated. So is the phone company my business associate under HIPAA? So this one's unique. We're a phone company, but the difference is how we're storing your data, how we're storing the voicemails, that we do sign a BAA because we want to show you that we are storing it in a HIPAA compliant way. But you don't necessarily need it for just the phone carrier because it's just the telephone lines. So they don't count as your business associate because it's just the live phone calls. And I like this example that we use. Just like with the Postal Service, it doesn't count as a business associate if you mail someone patient records. So it's a good example. But again, summarize, it's important how you store it. So you want to make sure you're storing any patient data, including voicemails or call logs or their contacts, in a secure manner. All right, what's the next one here? Okay, so someone mentioned this, like about using your personal cell phone. So if you're using your personal cell phone with a HIPAA compliant app, you're good. As long as you read the BAA and know that it's a good HIPAA compliant app like Spruce. But there's others out there, kind of. Anyways, but these, if you're using your personal phone, this is some of the ways that it can be risky. So text messages, I think we already talked about that the texts are being stored on your personal phone. Your camera roll. So if you want to take a photo of something, it's going to be stored on your personal. You need to take a photo of their records and send them somewhere. It's now stored on your personal roll that could be going to some cloud. Your cell phone uses insecure Wi-Fi that can be broken into and someone can start reading everything on your phone. Obviously, this is beyond my technical knowledge, but you know, that happens with Wi-Fi, especially if you're in public areas and not using encrypted Wi-Fi. Your contact list. I think this is the biggest violator and biggest scary thing. I think we've all been in situations where some app on our phone suggests a friend from our contact list or something like that, LinkedIn or Facebook or something. And so if you have your contacts in there, it's going to, if it's in your personal contacts, it's going to do that. If you're using a HIPAA compliant app like Spruce, it stores your contacts. They can never go into any of the other apps or anywhere else. They're just in our app. So theft, obvious. If your phone's stolen, then you've just given all your patient data to that person. Everything is uploaded to different clouds, which clouds are essentially just computers elsewhere that are storing your data, and we don't know if they're secure or not. All right. Oh, wait, we have a question. And so clarify, client list in Spruce, we can use their full names and not initials. Oh, I'm so glad someone brought this up. So before we had ways to have HIPAA compliant storage of contacts and texting and all these wonderful things that we now have available to us, the way that a lot of therapists were trained is to put initials. So JG and then whatever it is. No need for initials if you're using a product like Spruce. You can do full names. You can put date of birth. In our contacts as well, we have custom fields. You can put like all about them. You can do all of that. So no need for initials in Spruce, even if you're using SMS texting. So you're safe to go there. Okay, so email. Email is very similar to SMS. And mind you, I had to learn all this at one point, and I just remember being, this is so confusing. But how I really compartmentalize it is SMS and email both go over internet. They go from someone's email carrier to another email carrier. We don't know what email carrier they're using. We don't know if it's secure. We don't know what internet. Same thing for texting. I could be texting from AT&T to Verizon. Could be texting from Outlook to Google. So we just don't know. We don't have control. And so it's not predictable and secure. So email is something like text. So you want to find out the patient's preference. So that's number one, just like with text, and then document it. And then you can actually choose an email product that is more secure. And I don't necessarily mean an encrypted one. I just mean, you know, Gmail and Outlook are going to be way better than some certain other ones that are smaller brands. So there's certain email providers that actually are encrypting and storing their emails in a more secure way than other email services. However, if you want to send secure encrypted emails to patients, you would need to use a secure email, an encrypted email. You know, there's quite a few popular ones in therapy. Again, it's another software that's holding your information. So for those of you that were asking about Google Workspace, so Google Workspace, if you get your, if you're using email for them and you get a BAA, they're saying that they're storing all your emails in a secure way, not your contacts, but your emails. So, and Google Drive is an excellent product. It's all secure. You can store patient data in Google Drive if you have the Google Workspace. Oh, great question. Yeah, I forgot this came up earlier. Will Spruce add email? So Spruce actually has email today. It is a very lightweight, I call it hybrid email because it's going to be a hybrid domain email. It's going to, you get to choose the first part. So hello, info, at, and then your practice name. So Jessica's counseling.sprucecare.com. So it has your practice and then ends in sprucecare.com. Our email is not a end-to-end encrypted email. Our end-to-end encrypted is our app that patients download. So you have SMS and email, which both you need to get consent from patients. And then you have our secure app, which you don't need to get consent for because that's going to be encrypted from the patient to the provider. But back to our email. Spruce email, it does not have BCC, CC, so it's a very lightweight email. I wouldn't use it as your only business email, but it's fantastic for patient communication. It's going to show up as your business name when you email them. It's going to go into your Spruce inbox where your calls, your faxes, your texts go. So it's just one place. If you just need to hop over and someone's like, can you email me that PDF real fast? You can do it really simply. You just open up the contact and hit email. So, we would love, the next steps for our email is to offer more than one email per Spruce account. So you could have like Jessica at, you know, Carrie at, and then also just upgrading it. So there's junk filters or spam filters, BCC, CC, things like that. But it's on the roadmap, but I don't see it coming in the next 6 months. We have other things that we're going to be upgrading. I'm happy to talk about those at the end of the call. All right. Okay, so how can you increase your patient satisfaction and be HIPAA compliant? Well, ask them how they want to communicate. Don't make them go to some portal that's hard to log into or doesn't allow image sharing or doesn't allow, you know, mobile access. Like ask their preference. And if they want to text, then text. And that's just a really easy way. So, and then document their consent. So do this, you know, even in Spruce, you can do this at the very beginning of your text communication with them. And our data is stored forever. You can do this in the EHR. And then communicate, you know, just talk to them. Like if they're texting you a ton of information over SMS and you're feeling uncomfortable, it's your practice. It's your liability. So tell them, hey, I'd feel more comfortable if we talked about this in person or if you used one of our secure modules like the EHR or Spruce. So it's also really important, like, again, I'll emphasize this. It just breaks my heart to see that, you know, providers won't communicate with their patients because they're scared of HIPAA. If a patient wants to text or call, like, let them. Like, it's really important, you know, that they can communicate how they want. And, you know, texting can be a little overwhelming. So you want to make sure to use a software that has auto replies or something that allows you to shut it off or set expectations with your patient so you don't feel overwhelmed. That's definitely important as well. Okay, I think I got to those. Okay. Oh, okay. So we're, all right. So I did this. We are at the end of the slides. Here's some resources. These are all found on our blog at sprucehealth.com/blog. And we're happy to send them to you if which ones you want, just message us or search on our blog. And then the one that I like the best, because BAAs are so hard to understand and you're like, what are they even saying? We wrote a white paper to help you understand our BAA. And this not only helps you understand our BAA, it really helps you understand any. It goes through every channel type: phone calls, voicemails, text messaging, fax, texting, email. I think I said texting twice. But you can scan with your phone that QR code and get a copy of that paper right now. but we'll also include this in the follow-up. And yeah, so I just want to open it up for questions and say thank you for having me. And I hope this helped clarify and not confuse. But if it did confuse you, please speak up, and I'm happy to clarify further, or go into more details on any subject that you guys have.
I love it, Jess. I'm gonna just jump in and ask a question.
Great.
Back on the BAA slide, and I mean, this is just coming from a place of curiosity. Is there a template, like for people who are just starting out or they just don't know like how to create? Is there an easy way to create one?
Well, the beauty, Carrie, great question. So a BAA does not need to be created by the therapist. It needs to be created by companies like Spruce, companies like Google Voice, companies that you're doing work with. So that's generally the case. So you don't have to even do this. But if for some reason you do need to create a BAA, I am sure there are a million resources online and templates. And your lawyer could obviously help you as well, because it is just one of your other contracts that you're going to sign. So that is a great question, though.
Okay, awesome. And I did just see another one come in.
Okay, let me see here. Yeah. Going back to SMS and HIPAA. Okay, love it. Some referrals come from directories like Alma, which has a checkbox saying sometimes something along the lines, the client is allowing texting and email as communications when submitting a referral. Does this override the need for additional form? So the question is, to summarize again, some referrals like Alma and other places, before the patient, either client submits the referral, they're agreeing to do email and SMS per se. So when you're communicating about that referral, so it's kind of like, think of it as that's, you're doing business with the referral company and you. And so they got permissions to do texting and through the referral. I would have to read the exact verbiage of what they're signing. Is it just for the referral, or is it for if you end up using this therapist that we're referring you to, you're agreeing to do texting and email? So there is going to be nuance depending on what it actually says. But it definitely covers you. It sounds like, reread it, when you're doing the communication before they become a client. Once they become a client, I assume once they become a client, you're also having them sign your practice specific policies. And that's where you'd want to put the SNS and email preference there. If you're not having them sign additional policies for your practice, then I would assume that it's already been done through the referral source. Great question. Yeah, so someone asked, what are the red flags you should look out for when reading a BAA or signing a BAA? Really, it's the carve outs. And, with the Google Workspace, you got to dig. I mean, they make you dig, obviously, but I had to click through like 3 different pages to open it finally up to what I wanted. And it was a box that said you cannot store contacts securely. By agreeing to our BAA, you understand that we do not store the contacts securely and they shouldn't be stored in here. So I would say the contacts are the biggest red flag. The second most popular one is popular. I don't know if that's the right term. The second most common one, violation I kind of see, or assumption, people assume everything's good, is voicemail transcription. So Ring Central, last time I checked, they may have changed this, but last time I checked, you had to turn off voicemail transcription in Ring Central. And I don't know about their contacts. And then the other one, so Zoom, since we're using Zoom today, we have HIPAA compliant Zoom at Spruce that we use for professionally, like for doing stuff like this. And we had, in order to do HIPAA compliant Zoom and call recording, it had to be downloaded. It couldn't be in the cloud. So there's just little nuances. The Zoom phone, I think, has a lot of restrictions when it comes to HIPAA compliance. So unfortunately, you just have to read, but the biggest ones are contacts, voicemail transcription, and yeah, some will say you have to delete, like they'll delete the messages and stuff after a certain amount of days, and that's how they protect you. but that should not be necessary because you have to keep your records for so long. So you don't want to go to a software that says they delete the messages after a certain amount of time. Okay. Okay. I got another question about Spruce. So let me just, since we're here, let's switch to this slide. So does Spruce offer data and analytics like message open, message sent? So yes, Spruce does offer some light reporting and analytics. It is on our upgraded plan, and it is for practices that are over 4 or 5 users. So it's not available for everyone today. But within your Spruce account, you can actually see who's from your own team who's read and seen a message. With SMS text, we have no control over seeing if the clients read it. Think about on your personal phone, like if you use an iPhone, read receipts are only something that the receiving end has to turn on and off. So we can't do read receipts for SMS. For secure messaging, you will be able to see if they've read the message. So that's an advantage of using our app instead of traditional SMS. Analytics. So open rate, sent rate. So with our basic reporting, which happens in upgraded plan, you will see call answer rate. So how many people hung up, how many calls you got a day, how many texts, secure messages, faxes you did every day, how many messages each teammate has sent, how many, you get a little heat map that shows you when you're getting the most calls. So a lot of ways to analyze your practice. If you're a group practice owner, Spruce can be really valuable in team management. You can see, what everybody's doing. Should you want, you don't have to be able to see us, but it really helps with training. There's ways to do internal notes to, if you're supervising, you can see all the text messages and calls and how quickly your therapists are getting back to clients. So we even have, we did a webinar, and it's in our blog post as well, about supervision and using Spruce. So that's all in there as well. So, all right. I'm a Spruce subscriber. Bonus. Good job. We love you. No, I'm kidding. We love you all. And I cannot see when my clients read the messages. So I'll say this one again. So you have SMS and you have secure messaging. SMS through Spruce, when you're SMS texting from your Spruce number to a client, you cannot see read or unread. You cannot see if they've read the text message. That's just a capability you can't do, because the patients or the clients that you're texting would have to give that permission. And it's just, that doesn't happen through Spruce because we're not using the same system. If the patient downloads the app and you send them a message, in your message details, you'll be able to see if they've read the message. Should I reach out to customer support? Always. If you have a question, please, please, please. Spruce has so many little hidden capabilities. I'm constantly learning. I just learned that if you go on the web version of Spruce, you can select messages, which I knew. But if you hold down and shift and then go to the top, you'll select all your messages, and you can then copy and paste them to a doc and then have them as a whole record. So there's just tons of tips that our support team can help you with. So please don't hesitate. Go into settings, message us, and you can message Team Spruce. Yeah. Yeah, so they're going to be in your message details. Ask support. They'll send you a photo of where the read receipts are for secure messaging. All right, someone else had a question. This is a great question. I'm sorry I didn't address this earlier. Someone asked if I have Google Voice, but I want to move over to Spruce. Can I keep my same business number? Yes, you can keep your same business number no matter where you move. So if you want to move to Spruce, to Verizon, to wherever, your business number is owned by you. It's a regulation by the FCC that you own your number, and you can move it wherever you want. So just like if you're at Google Voice, you're allowed to take it and move it somewhere else. Some, very rare, some softwares don't, like Google Voice, the free version, I don't think you can bring in a number. But for the free version of Google Voice, if you want to move it over to Spruce, we do that, I don't even know, 5 times a day probably. We have 5 Google Voice numbers being ported or transferred to Spruce. When you transfer your number to Spruce, you will have no interruption in your service. So you will always continue to receive calls. They'll just go through from calling your landline or your Google Voice app to calling your Spruce app. And yeah. Okay, so I think I got a lot of these answered. Carrie, how am I doing?
You are doing great. I think you got all the questions answered and you covered so much great content. So, unless folks have more questions, I think we're going to be able to give you a couple minutes back to your morning. Looks like I see there's still a lot of folks on the call. You've all hung with us, which is amazing.
Any questions, HIPAA, patient, client related? I'm happy to give a stab at opening or answering them. All right. New features with Spruce. Well, I was trying to make it all about HIPAA compliance, but if you guys want to make it about Spruce, I love talking about Spruce. So do we have any new features coming with Spruce? So Spruce today allows you to call from your cell phone through the Spruce app and allows you to call from desk phones. So we have physical desk phones you can purchase through us and answer and make calls right from there. Coming next year sometime, we will be releasing calling from the computer. So you won't have to use your cell phone. You can just call directly from the computer. With that, you'll get a lot more added features with kind of seeing the incoming call on your computer and stuff like that. Actually, today we released something that if you have a desk phone through Spruce, you now will have caller ID, which is very exciting because before it would just say the patient's phone number. And then next year, we also hope to get some more EHR integrations, which was a question that just came up. Are we integrated today with any EHRs? Unfortunately, we're quite limited there, just in all transparency. We have an integration with an EHR called Elation Health, which is mostly a medical one. And then we're looking to do one with Athena next. You can always ask your current EHR if they partner with us, and the more they hear that, then the more open they will be when we knock on their door. If you are not integrated, using Spruce with the integrated EHR, which is pretty much everybody on the call probably, we have two ways to integrate. So you can import a CSV file of all your contacts. So export from your EHR, import to Spruce. Any questions, search our help center or ask our support team. Second way, if you log in on the computer version of Spruce, you can select any messages and hit copy and then paste into your EHR and it will reformat them to be time and date stamped. I see a trend of a lot of people not even moving stuff into their EHR because Spruce has such a good documentation source that if you were ever to need to go back to do something, you can search by phone number, by patient, by keyword, and find the previous contact history. But yeah, we'd love to get a therapy-based EHR integrate with our system. But it's a lot more complicated than you'd think. But so one day we hope to do that. Okay, well, feel free, if you go to sprucehealth.com, we have see a demo, so you can go see a demo there. You can go to sprucehealth.com. You can also email support at Spruce Health. And if you're like, I was talking to Jessica or I saw Jessica, webinar on this, they'll ping Carrie or myself, and we're happy to support you. We're a small team. Again, over half, I think it's more like 65% of our practices on Spruce are in the mental health field. And everyone's an independent practice, so small. And so we understand your needs. Oh, another feature that you may not know about, we just launched call flows to be built self-service. So meaning build your own phone trees within Spruce. So if you're on the communicator plan, you can build really cool call flows. So if someone calls the practice and you miss the call, you can set up that auto text. If someone calls the practice at night, you can have it do a certain thing. So a lot of customizations, and you now have complete control over setting it and creating it. It's really, I hate to say this, but it's kind of fun to create it if you like that sort of thing. I had a lot of fun in my demo account. So definitely, you can also ask our support team what new features. And on our blog, we have a newsletter, and you can go there for the latest and greatest. All right, Care, I'll keep talking, so you better cut me off.
Yeah. Did you see there was one more question that came in? I don't know if
I missed it.
It just came in.
Okay. I closed it. I got a little excited. Okay. All right. Question is, any recommendation for group practices that don't have ownership of phone numbers or the therapist to remain compliant? Yeah. So if you own a group practice and everyone's just their own contractor, you really just want to make sure that they're using the best product. And so you can recommend Spruce. You just want to, or you can offer to include their phone number and phone system in part of the other shared expenses. And yeah, or just encourage them and share this webinar, and because they're personally liable, right? It's if they're independent. So you want to share this or share that using Spruce in a HIPAA compliant way to encourage them to use a secure platform. So, well,
Good.
I really appreciate everyone's time. Again, if you have any questions, search our blog, email us. We're here as a resource. We've been doing this a long time. HIPAA is confusing, and so questions make sense. And it's a constant kind of work in progress. But really appreciate everyone's time. Carrie, I'll let you finish it out, or
Love it. Love it. Yeah, just wanted to thank you, Jess, for going over so much good stuff. Again, reiterate that you are all going to get a link to this recording. Herd will be sending that out to you. And I can also follow up with all of you with some of those great resources that Jess pointed out on that one slide. That way you don't have to dig for them. So with that, have a terrific weekend, and hopefully we will see you on another webinar soon.
Thanks.
Thanks. Bye, guys.